Hello everyone and welcome to our Spotlight segment. Today we have with us Dr. Quinn from Dr. Quinn Weight Loss, experienced bariatrics physician. Dr. Quinn is committed to treating overweight and obese patients. He and his educated staff are dedicated to providing an incomparable level of professionalism and treatment. They take pride in their patient-based care that allows clients to feel comfortable and confident in their weight loss experiences. Welcome with us, Dr. Quinn. How are you today?
I'm doing very well. Thank you for having me.
Dr. Quinn, having 3 weight loss clinics, you are clearly well established and experienced in your field. So tell us a little bit about your background and how you got into the weight loss field.
Sure. I went to Michigan State for my undergraduate and my medical degree. I did my emergency medicine training at Oakwood Hospital in Dearborn, and through my times as a ER resident and as an attending physician, I saw the effects that obesity causes and the negative things that happen to people from being overweight. So I figured it was a way that I could, something that I could do in order to be able to really help the community. So I developed and started Dr. Quinn Weight Loss.
Interesting. Wow, that's amazing. So what sets you apart from the rest of the clinics that are out there?
Well, our program is designed by me, a physician, which is, I think, important for a lot of patients to know that they're going to see a doctor during their program. And not only do we try to promote short-term weight loss, but we're also very interested in long-term weight maintenance.
Interesting. So if I was a patient and was interested in your program, who would be the person to help me out or start me on the program?
Well, all the initial patients are initially seen by myself, which I think is important. All the patients are seen by a physician to make sure I go over everybody's medical history, we do their weight and BMI and body fat, and after the initial consultation, then your weekly or twice weekly follow-up visits are seen by my experienced medical staff.
Oh, that's good to know. It's interesting because from what I hear or see, most of these programs you start off with the staff first. So it's nice that we actually can start with the physician. That's really interesting.
Yeah, I think it's really beneficial for the patients as well to know that we're going to go over your medical history and you're going to have a physician looking at everything and be able to design a program that's specific for you.
Okay. Are there any side effects with the programs that you offer the patients?
Well, we offer a lot of injections as one of our mainstays as part of our treatment. There's no side effects from the injections. They're all natural vitamins and amino acids. And the patients that qualify, we can start them on prescription appetite suppressants. Those are all FDA approved, and there's never been any long-term side effects that are associated with them.
Okay, that's good to know. Now, I'm sure you've heard this a million times. I can't lose weight. I've tried everything and I can't lose weight. I've tried every diet or every exercise program and I can't lose weight. So what do you offer? What do you tell those patients?
Sure. I think that's what sets us apart from a lot of the programs is that we're a medical-based program. You're seeing a physician. We're able to go over your medical history, and we're able to not only take people lower than the amount of calories than what a lot of other programs do, but we're able to control your appetite and so that you'll be able to get down to those amount of calories to be able to get the weight to come off.
Okay, that's good to know. Is your program safe if somebody was to come? Do you take everyone with their different types of medical problems, or is it geared towards specific issues only?
Sure. No, our program is safe and it's very effective. And I think, again, that's the benefit of me seeing the patients is that I'm able to design a program specific to each individual patient. So whether or not you have high blood pressure or diabetes or high cholesterol or heart disease, I'm able to design a program that's going to be specific for your needs without having any long-term side effects.
Wow, that's, I think in my opinion, that's really good that it's geared towards one specific patient at a time.
Yeah, exactly.
That's interesting. Now with this program, do you have to purchase specific foods or items or be on a specific diet?
Well, one of the benefits of our program is you're able to buy regular grocery store foods. You don't have to buy a bunch of prepackaged products. So you're able to eat normal foods. You'll be able to eat with the rest of your family, which is, I think, really important, especially for people that have spouses at home or children at home. They don't want to have to cook one meal for them and a separate meal for the rest of everybody else that's at home. So we teach you how to eat better and how to be able to live within the types of foods, eating the types of foods that you're used to eating.
Okay, with this program, can the patients keep taking their medications that they're currently on, or what other medications do you offer?
We have a line of pharmaceutical grade vitamins and amino acids that we start people on. And like I said, for patients that qualify, we're able to start them on the prescription appetite products, appetite suppressants. And there's no interaction with people's medications. I think it's important for patients to know that they'll be able to continue on with all the medications that they're currently taking, like their thyroid medication or their blood pressure medicine, their diabetic medications. The goal ultimately is to get them off of most of those medications if we can.
Yeah, that's true. That's really amazing. What would you tell our viewers here what to expect on their first visit?
Sure. The first visit, you're going to expect to spend about a half hour with myself. You'll be going over your past medical history, the types of medications you're on, diets that you've tried in the past, what's worked for you, what hasn't worked for you, so I can kind of get a feel of how I can structure the program in order to be able to get you to lose the weight, to get you down to your goal weight. We go over your blood pressure, your height, your weight. My scale is very accurate in calculating body fat, so we can tell you where you stand and then show you what the goals are for where we want to get you down to, and be able to calculate the amount of calories that are necessary for you to be able to lose the weight.
That's amazing. That's really good. For your current patients, what would you like? Are they expecting any side effects, or should they be doing like an exercise program with what they currently have?
Well, we always try and incorporate exercise into our program. I think it's really important. Exercise is one of the keys for long-term weight maintenance, so it's important for people to start exercising as part of the program, or to continue on with their exercise if they currently have an exercise regimen.
Okay. Just to let our viewers know, are they to expect to be hungry on this program, or what are the expectations?
I think one of the biggest benefits of our program is that we're able to control people's hunger so that we can take them to the amount of calories necessary in order for to get them to lose weight. It's interesting, that's one of the things that we hear all the time is, am I going to be hungry? And actually, you're not going to be hungry. We can take care of your hunger and control your hunger, and you'll be able to lose weight safely and effectively while doing it.
Wow, that's good. Okay, that's I think the key for our viewers, what they want to hear is that it's safe, and that's really important.
Absolutely.
What kind of injections do you offer? I know you were saying was some.
Yeah, we have what's called the Lipoden Plus injection. It's a combination that I have made with vitamins, amino acids. It helps to increase your energy levels. It helps your body to get rid of the fats, and it helps to increase your cellular metabolism. The patients that are on the injections, they do much better than patients that don't choose to do the injections.
Really? Can you give us kind of an amount of what to expect, like weight loss, or is it geared to a specific patient?
So the amount of weight loss you can expect to lose is anywhere from 10 to 15 pounds in the first month. It sort of depends on the patient, what their starting weight is, what their goal weight is. And then the goal is 1 to 3 pounds a week to be normal, healthy weight loss.
That's amazing. And for people with high blood pressure and diabetes, can they take these injections?
Yes, there's no side effects from the injections. People with all medical problems can continue on with their medications and still be able to be on our program and take our injections as a part of it. Can
you tell us a little bit more about other products that you offer and what the advantage is versus other things that are on the market? Because I know in this business there's a lot of things on the shelves.
Sure.
And how do you pick between what to offer the patients?
Sure. There's a multitude of different types of products on the market, like you mentioned. You can go into any drugstore and find, thousands of different vitamins. I think that's one of the things that's important about seeing a physician, so I can recommend the appropriate vitamins for you, for each individual patient, and all of the products that we have are pharmaceutical grade products. So we know that they're getting high quality products and at an affordable price as well.
Okay. Wow. All right. That's interesting. How long do you expect for the patients to see results?
Most of our patients will start seeing results within the first week, which I think makes people really happy. A lot of people need that initial motivation to see some weight loss so that they can continue on with their weight loss and help them reach their goal weight.
Do they tend to be happy with the results they see?
Yeah. Everybody is happy with the results. The majority of people that are coming are losing weight and referring their friends because of how successful they've been on our program.
Interesting. Well, thank you, Dr. Quinn, for being with us today. It was a pleasure having you here, and this most certainly interview was very educational. Thank you for being here.
It was my pleasure. Thank you for having me.
And ladies and gentlemen, Dr. Quinn has 3, like he mentioned, centers. They are in Rochester Hills, Clarkston, and Shelby Township, making it convenient for everyone to go see Dr. Quinn. Thank you for being with us on our show today.